Hello and welcome to another podcast from Odell Technology. Today we're talking to Mark Lomax from PEP Health. Hello Mark, how are you?
Hello, Stephen. I'm very well. Nice to meet you.
Very nice to meet you as well. Mark, could you tell me a bit about yourself and how you got where you are today?
Certainly. So, Dr. Mark Lomax, doctor by background, became an entrepreneur in the healthcare space about 20 or so years ago. And so for the last 20 years, I've been really forging a career trying to improve, change, innovate inside the healthcare environment. And I've been the CEO of PEP Health for the last 3 years.
Okay, can you introduce the audience to PEP Health and what you do?
Certainly. So when we think about healthcare around the world, one of the key parts to it is delivering a really good patient experience. And that's one of the fundamental pillars of what quality in healthcare is built upon. But the problem we've had is that we've been completely reliant on surveys for pretty much since forever. And those surveys or patient forums or other tools have been really restricted in terms of capturing a very narrow audience of the patient population and often giving misleading or false insights in terms of what's really happening on the ground. So PEP Health was designed to really democratize that patient voice. And so what we've done is develop a new technology that reaches more patients, more voices in a much more expansive way that isn't reliant on that survey tool of how people have always done it before, which we think is a way of really being a game changer to give faster, more real-time, more informative insights to people who are interested in that patient voice across the healthcare ecosystem.
Okay, Mark, so what's unique and different about your solution?
So the key part to that I think sort of really starts to change it is that this is an automated solution that reaches into the digital universe, whether that be social media platforms, online review platforms, chat forums. And if it's in the public domain and there's lots of patients talking about their care, we're interested in it. And we aggregate millions and millions of comments from patients around the world and bring that together in a way that starts to generate meaningful insights into the healthcare world. So what we do is we map all those comments to the healthcare systems, whether that be by locations, whether it be by diseases, whether it even be by drugs. And we can build up this 360-degree view then of that patient journey from all these comments that are people freely giving, the things that are most on patients' minds. And we turn that into meaningful insights that stretches further than any other technology has been able to do and is the only one that's been empirically proven to actually generate meaningful, actionable results.
Okay, so some people might wonder that there's anything useful to learn from free text comments made by patients in the public domain. What would you say to those comments?
Yeah, well, it's often one of the first challenges we get back, Stephen, and I can somewhat understand why people would think that, because when people look on social media, they might see some very extremely negative stories that are often the ones that appear in their feeds first. And unfortunately, that's part of how those algorithms are built themselves. The things that are the most liked, the most retweeted, often get the most noise and the most attention. But we don't view this from the volume of how many views, how many likes does something actually get. We go back to the raw comments. And so what we're able to do is to have this ability to sort of reach into this, what we like to call the democratization of the patient voice. There are so many more comments out there that people don't know about, and they have been put there, sort of patients trying to sort of get them into the right place, but not often always doing so. So by spreading our net further and bringing it all together, we know now that it's been validated in the UK, not only in a small sense, but also against things like regulatory inspections. And just from that public voice, we can determine exactly what's going to happen inside a hospital. We've had the paper published in the Lancet, looking at it from the disease pathway point of view. So we know that side of it works as well. And most recently, we've done some really fabulous validation work in the USA, where we know that in that market, where it's much more competitive, very different drivers, we are still absolutely meaningful. And we know that our scores correlate to things like the HCAP survey. And we know that these components really have a material impact. And if you don't listen to your patients, whatever kind of offering you have, do so at your peril, because whether you agree with what they say or not, we're literally holding up a mirror as to what all these patients are saying about their experiences of care.
Absolutely. So, Mark, who would want your insights?
So potentially anybody who's interested in the patient experience and has at their heart a degree to want to bring that patient to the fore of their decision making, thinking about how they should go about doing things. As it stands today, we work with a number of different providers and payers. They range from hospitals and insurers and national bodies like regulators. And then on the life sciences side, we work with pharma, who really want to understand the unmet need of patients, real world evidence, really wanting to understand what's actually happening, either against the disease continuum or against looking at it from a drug point of view of what's actually happening. So there's lots of different ways that we can do this. And I think for us, it's really sort of wanting to engage closely with individuals so that we can refine that proposition and make sure that that patient voice is really well understood and meaningful and accurate for anybody who really wants to get a hold of that type of insights.
Okay, so you mentioned pharma, thinking specifically about the pharma life science industry. What is it you can help them with?
So there's a lot of pharma now who, when I talk to them, they have a number of real key challenges that they have to address. They're desperate for some really meaningful real world evidence about what's actually happening to patients on the ground, and really trying to understand how that correlates to best practice or guidelines that might exist in various territories. And unfortunately, they've been reliant on patient forums. They know that they can't actually sort of go directly to the patients in many territories as well. So what we can actually bring is that voice back to them and really give it to them, either in a sense of, this is the state of play of disease X in country Y, and you can really understand the challenges, the what's happening to a patient point of view, which can either help with a public affairs side with lobbying and asking for change, or more tactically, it can really help target resources into the areas where patients need it most, so that they can either uptake that treatment better or have a better adherence to it as they go onto it. Or for those that are looking to bring new assets to market, you can really help give that understanding of, this is the situation today, this is what's actually happening on the ground, and really giving it the really meaningful impact from the patient point of view, what's actually happening. And compared to a number of different solutions that we know are similar but different, we're confident that what we offer is a much more detailed, much more incisive viewpoint from that patient perspective.
Okay, so that leads us on to what developments are you planning for the future?
So lots of really exciting things for us looking ahead, Stephen, which is fabulous. As it stands today, we collect the patient experience for about 100 million lives. And by the end of this year, that's going to be up to about 500 million, or half a billion lives, which is a great landmark for us to be moving quickly towards. And that really is us capturing the whole of the patient experience across the whole of the USA, which is, from a data capture side, what we're doing. We're also building out the technology so we can get ever more nuanced, ever more insightful insights coming out, and we're doing a lot of work now moving from NLP, which is natural language processing, to natural language understanding, which is where we can understand a whole conversation in terms of it from their health point of view, and different people offering different perspectives. So we're really excited about these developments, and it will give us that much more richer insight again. So it's the start of probably what's a much bigger mountain than we even anticipated at the start. Right. But I think it makes it so meaningful that we can really bring this patient voice to people who are the decision makers around healthcare, to hopefully help them make better decisions. That it's a very exciting time to be bringing that patient voice to the market.
Absolutely. So, Dr. Mark Lomax, if people want to find you, where can they?
So our website, well, PEP Health, Google us, you'll find us, pephealth.ai. I'm on LinkedIn as well. So if anyone wants to reach out, sort of any which way they want to reach out, I'd be very happy to give people more information should they wish.
Absolutely. Well, thank you very much for your time today. It's been a pleasure, and I wish you all the very best in the future. Fantastic.
Thanks, Stephen. Really enjoyed it. Thank you.